Exercises. We're going to talk about this word exercise because it kind of bothers me, as you can tell, but I'll tell you why. But exercise history is positively associated with adherence in cancer survivors. We know this. And remember, what word pops in your mouth when you think, I mean, just as he said, one word, all these thoughts. When someone says exercise, I think of all of this stuff. You know, I think of dance, I think of yoga, I think of kids playing, I think of people standing out in the corner, I think of everything that's possible. And understanding this range is very important when you communicate, when we all communicate and we talk about exercise. There's resources, you know, for our patients routinely, everyone under treatment and after treatment, we have a movement seminar that we do once a month where we just get down and we're present. That's it. You're not in class. We're not talking about you sweating. If you sweat, great. Well, you're connected to your thoughts, your emotions, whatever it is, and it's great. So the universe doesn't give you what you ask for with your thoughts, but it gives you what you demand with your actions. So proof, right? Everyone wants, well, what's the proof? Well, proof if proof was needed. Obviously, big JAMA, physical activity and survival after breast cancer diagnosis. Now, there's a lot of work done in GYN cancers as well. So don't be like, well, you know, this one doesn't necessarily apply to what I'm talking about. But you can see that a lot of this has come. I cut out a lot of this talk because there was a lot of articles. This particularly showed 40% lower risk of breast cancer recurrence or the dying from the breast cancer itself. So, as we said, physical inactivity, the fourth leading risk factor for global mortality. So there's 3.2 million annual deaths due to insufficient activity. So let's not overthink it, right? We're not really talking about, we want to think about exercise too, but we're just talking about activity. There's some other statistics here, but this is a worldwide phenomenon. You know, I was in Brazil very recently talking about making moves universal, and a lot of people noted, yeah, you know, there's a little bit of inactivity translated a little bit to this low-level sort of mental inertia. It's like this background level of resentment, like call it depression, like this kind of, I call it like modern day global problems that are going on right now. But you see it, and it's coming on, and I don't know what that implies, but I think we'll get into it a little bit more, what that actually means. Sleep. I like to talk about sleep because everyone seems to be sleeping less. A lot of people are sleeping less than 5 to 6 hours and 7 to 8 hours. So we sit here, we talk about it, say, how you doing? Everything's good, you did the treatment, what's going on? And maybe, 5 weeks down the road, yeah, well, I'm not sleeping. So there's a lot of research on sleep, but suffice to say, there's a lot of deprivation effects on the brain where your brain can't actually process. So your attention goes down, memory goes down, and all of your functioning goes down. So what happens? You feel unwell. So when that is an issue, you should bring it up, maybe perhaps to somebody, or be like, I'm having a problem sleeping. It's important. And don't forget this. There is an arrogance of ignoring sleep. It was perpetuated. I think it started a lot even in the medical field. Oh man, I don't sleep at all. I sleep 3 or 4 hours. I didn't sleep. There's nothing cool about not sleeping. Okay, even if you're busy, I got this and this thing going on, but still, it's so important because it's so important to restoring yourself. Again, just a lot of words here, but when you sleep less, all of these negative processes start happening. You have an increased stress response, your immune function goes down, higher rates of insulin resistance, and you promote these growth factors that cause inflammation. So that's just the reality, and we can show slide after slide. Of course, we won't get into this, but of course there are things we can do. This is from the NCCN. There's so many different modalities to help sleep. There's imagery, hypnosis, distraction, relaxation, but there's a bunch of things. And now with the internet, you can probably download things for free. And there's a couple really, really good sites that I'll share with you that you can go to and just check it out. See what they have to offer, but it's literally at your fingertips. So we live in cell phones and technology, but technology can be a really powerful tool, and it's pretty phenomenal. So accept whatever comes to you woven in the pattern of your destiny for what could more aptly fit your needs. At first, it's kind of like, well, I don't want to accept everything, and I get what you're saying. But there's something about respecting and honoring the present moment that's very, very profound, and it's what moved me actually to make moves. So meditation, it's kind of this word that people kind of sometimes have an idea of what it may mean. But at its very fundamental level, it could be just focusing on your breath. It could be at a little higher level with respect to your faith, how you do it. But it's about accessing the present moment, understanding that your mind is not really who you are, and when you focus on something, that's exactly what happens. And we can go into like a lot of techniques, etc., but we won't go there. But we'll suffice to say, look at the decreased cortisol response. Look at the stress hormone response. I know this is just one of many statistics, but you're actually going down. So people that regularly practice these techniques have a decreased physiological response, just as the pastor already suggested. What you think and how you think can actually influence your immunology. And that's pretty profound. I think it's great. And here it is. The meditation techniques, we're not talking about 2 hours a day. It could be 2, 3, 4, 5 minutes. It's about frequency. It's not about how long you do certain things. You know, we get focused a lot on these details about how long, how much time do we have to do this, but sometimes it's just about frequency.